Okay, good evening, everyone, and welcome to our 2020 Superintendent Forum, The Path Forward. I'd like us all to begin with the standard Pledge of Allegiance. So if we take this time for anyone from my administrative team and any of this home, to please join us and a Pledge of Allegiance to our flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This evening, we will be walking you through a path forward. It is a tentative plan we are rolling out to our parents, our staff, and our community based upon the guidance we have received from the governor's office that all schools in New Jersey, public schools, must put together a plan that brings back our students to in-person education in some form within our schools. With that, we have other guidance we'll be using from the CDC, local health officials, and some of the best practices that we could find in guiding us through a journey that really has no GPS system. This is because obviously we all know these are unprecedented times. We can only rely back to 1918 to a pandemic of this nature. And it gives us limited resources as to who to call on as the experts in the area. So a lot of this we do is due by looking to other experts in the area who have similar experiences or what has worked for them when they've had trial and error. Tonight we will cover, in our next slide, the process that we went through, the task force teams, what we've used, the timelines that we've had, our survey results, our goals, our proposed school plan. And I must say it again, this is tentative. There is a process, our health and safety protocols, and then our next steps. So the road back, if we can all remember back to March 12th, when this all began. On February 4th, I put a letter out to all parents that was in the parent portal, warning that looking at what was happening in Asia and then just getting into Europe at that time was the progression of a virus similar to the flu, only called at that time the coronavirus, now since transformed into COVID-19. And we talked about some of the same precautions that we'll be using today. You all remember that it wasn't short after that, in the beginning of March, our schools had to close because of a case that became related to us in Old Bridge. We've heard from many experts, from the CDC to locally. Everyone in politics has weighed in on the best ways in which schools should open, should they open, why it's important. And as the stewards of the schools, we must follow our directives and provide a plan. But within that plan, I promise you along the way that I exercise the greatest level of caution when putting something together that's going to impact our students and our beloved staff. I remind everyone that Old Bridge is a family, and we've gone through some tough times together. They seem to come up more often than not, but each time we've come out stronger. And I often relate back to the time after 9/11, when we did come together stronger as not only a nation, but here locally within our community. I intend to do as every father and parent did during that time, is to protect their family, gather them together, because that was the most important thing to do, and try to make everyone feel safe. The decisions we have to make will not make everyone happy. I've already become comfortable with the idea that I'm going to not make people happy this evening. Some I will make happy, but it's not one of those situations at the end of the day that you're going to make everyone happy. I learned early on from speaking to a mentor that the best thing you can do as a superintendent of schools is always err on the side of protecting your children. If you do that, then you've done your job. We are doing this, and like I said, creatively creating a house without blueprints. We were told to have a plan together. We were told that a checklist would be provided to us as to what our plan must have. And as of this time and date, we still have not been given that checklist. And by the end of this week, after board approval, I must submit it to the Department of Education for acceptance. So during the course of the night, we have a few options for questions. I've already responded to several questions on our website, our email that we set up, COVID reentry questions at obps.org. As you can imagine, I get probably 100 to 150 emails a day. Most of them are someone trying to sell me something to make COVID go away. And I wish it was easy that was something we could buy. But I don't want to lose your important questions in that flood of emails that I receive. So we set up a separate email address just so myself or my team can address some of the questions that you may have, not only, but going forward. Until we have beat this, we will continue to answer questions through our COVID reentry questions at obps.org. As time allows, we will answer any questions that come up with the Zoom chat. Hopefully we'll be able to review them and answer them as can be. And I remind you that at this time, everything is subject to change. All of the plans we have are tentative. The board has to review and the Department of Education has to review, and then a final document will go out to you within the next coming week. I just hope we can all appreciate that we're kind of doing this in Old Bridge differently than most districts, that we're having this kind of interactive talk through as to where we're going, instead of just sending you an email. Our teams, our reentry teams, and our remote learning teams, we realized right away that we're going to have at least two teams. One to focus on the importance of reentry and everything that we need to reenter into the safest environment possible. And two, to have a remote learning team in place, because whatever plan we used, we realized that because of CDC guidelines, there will be a necessary element for some component of remote instruction. The pessimist might say that eventually we will be on full remote instruction. I ask the Department of Education on a regular basis, when I have the opportunity to meet and talk with them, what is the difference between August 2020 and March 2020? What do we know differently about this virus, about this disease, that would be preventable and help us so we don't close a school district down in those situations? And their answer is, the only thing that we have is to wear a mask at this point. That is the only thing that's been proven to reduce the number of incidences and new cases within the state of New Jersey and locally. So our reentry team consists of parents, administrators, teachers, transportation, maintenance officials, custodial officials, nurses who've received directive from doctors, our food service personnel, and our union representations. We'll go through the process. We sent out surveys to our parents. We sent our surveys to our staff. We're going to review the elements of that survey. And with those surveys, we took the results and we met weekly as a team with key takeaways and guidance on how to build upon the next week's meetings and what we were building upon, and creating that framework that we felt was the safest for our reentry. And the reentry is what we're going to focus on tonight, the reentry plan, because that's what's due to the state by the end of the week, and to the public the following week. We work within the state guidelines from the June 26th directive all the way up to last Friday, when we had new guidelines presented to us. You have to remember, as I talked about building a house without a blueprint, or I've said throughout the course of this, it's like flying a plane while someone else is building it. The guidance we received up until last week was that, and even when we asked repeatedly, is there an option for parents who do not want to send their children to school 100%, where they can remotely learn 100%? And up until last week, we were told there's no option for that. If they want to do that, they either have to have a 504, an IEP with a pre-existing health condition, or they have to disenroll from your school district. That's the way we planned. That's the way we built our cohorts. And then on Friday, or Thursday or Friday of last week, we were presented with new information that now parents do have that option. And it's not that I didn't support that option. That's why I was asking so vehemently, because I support that option for parents. I think it's your right as a parent. And I think we have a responsibility to remotely educate your child if you're not feeling comfortable with this situation. I tell you this, as I have 5 boys in my house, 2 in college, 1 in high school, 1 in middle school, and 1 in elementary school. And I still haven't decided what I'm going to do as a parent, because I'm concerned. So for me, you have to have that option. But for us, it's a planning nightmare when you're told the last week prior to presenting that you have to change it. So Dr. Hoker is going to take us to the next slide and walk us through the survey results. These have been on the district website. These are the highlights of the elements of the survey results. Dr. Hoker.
Thank you. Good evening, everyone. Our family survey highlights, we had quite a number of responses. 3,618 families responded, representing 5,486 of our students. Our results, like many other districts, were very mixed. We had, regarding returning to school, 48% of our families feel somewhat or very uncomfortable returning to school in the fall. 43% of families feel somewhat or very comfortable returning to school in the fall, and 9% are just unsure. And these, I think if we ask these questions today and then we ask them again 2 weeks from now, we may get a little bit varied response with new information. Regarding the approach to learning, when asked how many families would want 100% in-person learning, 41% of families would opt for that. 37% of families would like a hybrid approach, and 22% of families would like 100% remote learning. Again, if we ask these questions today or again next week, we may get a little bit varied response. I think we could all say we would love to go back 100%, all students full-time, but that's not necessarily a realistic thought right now. The top 3 concerns regarding re-entry from our families are children and staff coming to school sick, the cleaning and disinfecting process, and being able to maintain social distancing in classrooms. The staff survey highlights, we received 1,018 responses. Again, with some mixed results, we had 53% of staff members that are somewhat or very uncomfortable returning to school. 36% of staff are somewhat or very comfortable returning to school, and 11% indicated that they did not have a preference one way or another. 92% of our staff did indicate that they would feel more comfortable returning to school if both students and staff were required to wear masks. And the top 3 concerns regarding re-entry to school from our staff members are the general health and safety guidelines, the screening process, the protective equipment, and the response to student and staff presenting symptoms. And the third is the student flow and entry and exit and common areas, moving through the hallway. If we were to have lunch, how that would handle entering and exiting the buildings. So the additional full surveys are available online. They also include some common threads with feedback regarding instruction and other concerns.
Okay, welcome everybody and good evening. My name is Jim Toohey. I'm going to be going over the proposed plan for the upcoming school year. And again, thank you all for joining us this evening. On the next slide, you're going to find the 4 main goals that were established as a group. We have worked since April to begin looking at not only what an expectation would be for the district, for our staff, our students, and our parents, but also establishing 4 clear goals when planning to return to school. Those goals were as follows. Number 1, maintaining the health and safety of students, staff, and the community. Number 2, maximizing and individualizing student learning. Number 3, supporting teachers and staff with appropriate professional resources to maximize learning and interaction. And number 4, establishing a sound operational and financial foundation for the district for the 2020-2021 school year. These goals have been paramount to everything that we have done so far, and you will see that they are highlighted in multiple ways as the plan is shared with you this evening. When we created the hybrid plan, it was based on not only the survey results and the research that was already done, but the input that we received from parents, from staff, from administrators, and also aligning with the 4 district goals that were outlined just now. Additionally, we wanted to have a plan that was going to be scalable within a hybrid form that we thought could potentially add to the number of students who would be attending in person potentially as we move through the year. And the third option, and again, this was something that we had been looking at from the outset, although now with the proclamation from the governor is now something that will be part of the plan, is a full-time remote learning option for parents, parents who are concerned about returning to school and addressing some of those needs that those students have as we transition. So the goal, the hybrid plan that we are proposing is it's a plan based on a 33% capacity. So what does that mean? That means on any given day, any given week, students will be attending one of 3 days per week. The schedule, which we will see in a minute, will consist of 3 cohorts, cohort A, B, and C. Students, the entire Old Bridge Township student population will be divided into 3 separate groups. A third of the students will attend on Monday, a third of the students will attend on Wednesday, and a third of the students will attend on Friday. When attending school, all students will be assigned 1 day per week, and all in-person days will be half-day schedules, meaning that on the elementary level, the day will be from approximately 9:15 to 1:15. Middle school will be from approximately 8 to 12, and the high school level will be approximately 7:35 until 11:42 or 11:44. So each of the days, each of the half-day schedules will be aligned for the respective grade levels. In part, as Dr. Hoker highlighted previously from our survey results, the main areas of concern that were brought up by parents and in some level staff as well was addressing students who come in ill, students and staff who come in ill, the cleanliness of the buildings, and also maintaining social distancing. The district return to school committee believes that the 33% capacity plan will allow for all 3 of those areas to be addressed on a clear and concise basis each and every week. On Tuesdays and Thursdays, there will be a district-wide remote learning plan for staff and students. And on those Tuesdays and Thursdays, each of the buildings will be available for a cleaning process through our maintenance staff. In every cohort, to the best and greatest extent possible for the district, students will be paired with their siblings to ensure that they are in the same cohort and facilitate that, and the administrators are facilitating that as we speak. Some of the advantages of the 33% hybrid plan include the following. Number 1, it allows for the schools to start in-person instruction with relatively small classes. So let's take an elementary school, 2nd grade classroom of 24 students. On any given day, only 8 students would be in that class for an in-person instruction. That not only allows for maximizing the social distancing component in each classroom, but also ensuring that the students can receive a pretty significant amount of the teacher's time during that half-day schedule. All students would receive a minimum of 1 day of in-person instruction weekly. There would be limits on the number of staff and students inside the building to facilitate social distancing. And initially, as again, we rolled out this plan, we thought a third capacity could facilitate both the social distancing component as well as limiting the number of individuals within the building. The 33% plan also allows for maximizing the cleaning and sanitizing between the groups, because there is always 1 day, and then a weekend in between when the groups would come into the building. So all 3 cohort groups, A, B, and C, are really siloed on their given day, meaning that they're not necessarily going to interact with cohort A is not going to necessarily interact with cohort B nor cohort C. And because of that, we think the district can minimize the impact of a potential student who is ill in maybe cohort A, but that wouldn't necessarily interrupt the in-person instruction for cohort B. There we reduced class sizing, allowing for increased personalized teacher instruction in each of the classrooms. Again, on an elementary school, you would have 8 students as opposed to potentially 24. At the high school level, if you had 30 students in English class, you would potentially have 10. You would reduce the total number of students potentially allowed within specialized programs, but you would allow for potentially those students who are needing special education related services, students in RTI programs, and potentially the ESL populations to receive a bit more in-person attention based on what their needs are. And the 33% plan, which is also very scalable, meaning that we can move from a 33% capacity to a 66% capacity by simply adding another cohort to an in-person day. Many other districts in the surrounding area are doing a 50% model. That really is one of 2 things. You're either going 50% or 100%. because you're either bringing everyone back or you're sticking with the 50% AB model. This model not only allows for the goals that have been outlined and the concerns that were addressed within a lot of the survey information that we received, but it also is very scalable to increase the number of students who could go in person as the health trends in New Jersey are further looked at. The advantages to a half-day schedule would include it's a appropriate and tolerable amount of time for students to wear a mask. Would be approximately 4 hours on any given day across any given level. It allows for additional teacher preparation time to facilitate remote learning for cohorts who are not receiving in-person instruction. There are no lunches, and there would be a grab-and-go lunch option for students across all grade levels towards the end of the day. And then it provides, especially on the elementary level, a more concentrated approach to instruction in the core areas like English, reading, and mathematics. On the middle school and the high school level, we will also be focusing on those on the high school level, in particular, the core areas for graduation requirements. And the middle school as well will be looking at English, math, science, and social studies as a core content areas. And each of the 3 grade levels will have some sort of modified schedule, which will be released at a later time once those are finalized. So the next slide provides you with an overview of what a schedule would potentially look like. Now, again, there is a 4th cohort here, which I will go into in a minute. But as you can see, cohort A would be attending in person on Monday, and then they would be receiving remote instruction on Tuesday, Wednesday, Thursday, and Friday. Cohort B would be coming into school on Wednesday and would be receiving remote instruction on the other days. Cohort C Friday, and cohort D, and again, we'll get into this a little bit more when we talk about the full remote model, would be remote all 5 days. Teachers and staff in this current model would have Monday, Wednesdays, and Fridays in person. And on Tuesdays and Thursdays, they would be participating in full remote instruction for the district as a whole. The roles and responsibilities of the teachers and staff on those remote days we are continuing to look at to ensure that the students are receiving the best and most comprehensive remote instruction on those days, on those district-wide remote days, and further guidance on that will be released as we move through this process. So to summarize what the options are on the next slide, what the family options are. And again, these are not necessarily the only 2 options for students who have, for parents who have students who are medically fragile. There's a potential to also have a home instruction component. And if you have that question, you would approach your building level nurse. But as described tonight, there are 2 main options for parents. The first is a hybrid model, which is both, again, in school and remote. And the second option, as released by the governor on July 24th, is a 100% remote model. Both of these models will have multiple components that we were able to continue to address from learning from what happened in March, April, May, and June of last year. Each one of these components, both the hybrid model and the remote model, will have a live check-in with the teacher. There will be teacher recorded lessons. The teacher will lead remote small group activities. There'll be online self-directed activities, and there'll be increased opportunities for students who are identified as needing special education and related services, RTI, and ESL as well. And we're continuing to focus on the district level plan. And once that is finalized, ideally on Thursday by the Board of Education, then some of these other details will be released in terms of what the expectations are on those Tuesdays and Thursdays for full district remote days, as well as what the teacher expectations are and schedule-wise on those in-person days across the various 3 grade levels. On the next slide, there's just a general description of the impact of what's called the 100% remote option. Again, up to this Friday, last Friday, July 24th, there was not a clear outline by the Department of Education or the governor outside of an announcement earlier that week about the 100% remote option. There have been parents who have been inquiring about potentially homeschooling. There have been parents inquiring about online programs. But based on the summary that we received from the governor, Old Bridge will be providing a 100% remote option. Within the next few days, there will be a survey that is going to be presented by Dr. Hoker and the administrative staff. It will go out to all parents, and it will not be a commitment, but it will be a general idea of the amount of parents within the district who would be potentially looking at a 100% remote option. As was stated earlier in this presentation, the construct of this plan, the 33% plan, was done prior to the governor's proclamation of the 100% remote option that was necessary for all districts. So it is subject to change. But at the same time, the 100% remote option was something that the district has been reviewing with the idea that it could possibly happen. And there are two options within potential options for the 100% remote option plan. The first option is where students are linked into their respective cohorts. So for example, if you're a second grade student, and if your student is a second grade student in Carpenter, a sixth grade student in Salk, or a high school student in 10th grade, they will be scheduled as they would normally be scheduled. They would be in with a teacher. They would have their 8 periods in the middle school, 7 periods in the middle school, 8 periods at the high school. And then they would simply opt out of their scheduled in-person day. This is the simplest of all the options because it still provides the students with a construct of a schedule. It allows them to be integrated into a class on all 3 grade levels. And it also provides the parents with a very simple opt-out. I'm opting out of my in-person day. However, you would still receive, your student would still receive the various remote activities that were being provided to the students within the other cohorts. Option 2, and again, this is contingent on how many parents are examining or contemplating going 100% remote for the school year, would be to have a 4th cohort that is created. That 4th cohort would be the D cohort or the all remote cohort. And potentially there would be teachers based on the needs and based on the identified number of students who would be assigned specifically to that remote cohort. And the students in that unique cohort will receive instruction from that respective teacher. Both of these options are being examined. And again, as the provisions by the governor were relayed just this past Friday, we are still working as to which of these 2 options would be ideal for Old Bridge Township public schools and the community as a whole. But these are 2 of the options that are on the table for the 100% remote learning option for the 2020-2021 school year. And we will provide an update as soon as one is finalized. On the next slide is the general next steps, not only for the in-district program, but also for the remote program. These are things that the district is finalizing over the course of the next week, with the idea that week and a half, that the teachers, the parents, students, as well as faculty and staff will have a clear-cut understanding of what the expectations are for them going into the school year. So the next 6 steps towards the implementation of this in-person 33% plan and the subsequent 100% remote would be to create the checklist of teacher must-dos to start the school year. That is in process currently on all 3 grade levels, elementary, middle, and high school, to ensure that the teachers are well aware of what their responsibilities are, especially those first 2 weeks of school, where students are obviously going to be a little out of sorts with the schedule because they're only going into school approximately 1 day per week. Right now, the district is creating common resources across all grade levels to ensure that teachers, upon their return to school in September, will not only have access to any online activities that they need, any online teaching resources, but also teacher-driven activities created by Old Bridge Township Public School teachers. By having this robust library for the first few weeks of school, it would be a excellent tool for teachers to roll out some of the activities and a transition through the difficult September months when we are moving to a 33% and then obviously the virtual days. We are going to establish the schedule for the two in-district, district-wide all remote days for Tuesday and Thursday. We are finalizing the all remote option for students and families upon request. Again, there will be a survey coming out, a non-binding survey coming out within the next few days. Please keep an eye out for that. We will be reviewing district courses, especially on the secondary level, to determine viability of being run during the course of the school year. And finally, developing elementary, middle school, and high school norms to ensure the district has a positive transition to the 33% and virtual days, and hopefully never get to that point, but also have potentially a positive transition if unfortunately we do have to go to a full remote platform based on the health progress of New Jersey. Those components to the norms would include attendance, assessments, scope and sequence of materials across all 3 grade levels. And overall, these 6 steps are being worked at expeditiously by the district as a whole. So thank you very much, and I'll turn over to Mr. Adino.
There we go. On the next slide, we will see I know there's a few questions that have come up in either the email, and that's that little ding you hear when I'm speaking. Questions going to the email that we provided for you at COVID reentry questions at obps.org. So just kind of reading through those while Jim and Kathy were talking, so I can get some ideas and some questions I can respond to at the end. But this is one of the ones that came up that someone had asked about lunches that we considered the grab and go, because it is early dismissal. I don't like to use the term half day because half day implies less than what the day is. And early dismissal is the difference between 1:15 and 3:15 at the elementary level. What we will be providing is breakfast for those students who participate will be available in the homerooms or classrooms upon arrival. And throughout the course of the day, at the end of the day, meals will be available for the grab and go model on their way out the door. This will be not only that day's lunch, but meals for the next few days. If it's like a Monday or the Wednesday, Friday, students may receive that Friday. And then we're also going to have pickup available like we had throughout the course of the spring. So there'll be several opportunities and places available for families to pick up. And extreme circumstances, we obviously will make other considerations. Snacks may be brought in from home and provided to students when and where appropriate. I understand, especially for elementary students, that getting through until, well, I know I have two 19-year-olds at home, so they eat constantly anyway. So for every kid, there might be opportunities for them that they get hungry, have a snack available on the go, because these are different times. The most important component of it is that, people are using good hygiene products when they're eating. They're washing their hands prior to eating. They are using hand sanitizer. They're getting rid of any waste that can hold a virus or a contaminant from that point on. We'll be looking at health and safety protocols next within our presentation. The next is our wellness checks. So prior to entering the school, staff and students will have wellness checks. We're working with real time. I spoke to the president there on having a survey questionnaire that parents and staff would have to just check off prior to arriving at work that day, that they feel good, they don't have the pre-existing conditions that are there. Upon arrival at a work site or at school, all staff reporting to a work facility will self-check their temperature within the vestibule prior to entering the main part of the building. If a staff member reads a temperature, they are to immediately leave the building, report back to their vehicle, and use a cell phone to contact their immediate supervisor. Student temperature checks will be screened prior to disembarking from the school bus, prior to a parent guardian driving away from a car drop-off zone within the schools. And again, that's going to have some modifications to where students are dropped off as they were in the past. These are different times now. We'll have to look at the best place to do it safely for our students. And students that are maybe walking to school, especially that only happens at our elementary level, and or high school seniors who are driving to school, having separate entrances for themselves to receive a temperature check prior to entering into a school. Now, here's where it gets interesting. We'll talk about some of our concerns here. Protocols for symptomatic students and staff. Any staff reporting to work self-screening elevated temperature above 99.9 degrees will immediately return to their car and contact their immediate supervisor. Students being screened prior to entering the school who exhibit a temperature above 99.9 degrees will be escorted to an isolation tent for review by the school nurse. Obviously, we'll do more checks there. So some people have asked on chat and whatever, or just asked in general, how come you're not doing it prior to getting on the bus? The problem is, legally, you are my student once you leave your house. So when a student arrives to the bus, even if you are just demonstrating a fever and we're not checking there, I can't just leave you there. I have to take you on the bus and I have to take you to a nurse, because once you're my student, I've exhibited that there's some type of health concern for you. I have to have the school nurse review your health. And I assure you, during the course of this, having nursing professionals is going to be difficult as it is, but I do not have nursing professionals to ride 75 to 65 buses on 3 routes daily. So we have to bring them to school and we have to assess their health upon the arrival at school. So that's why it's important for all students to wear masks on the bus, to practice that social distancing. And that'll be in a transportation slide a little further down. We'll get to answering that questions. Students and staff exhibiting symptoms of COVID-19 will report to a designated isolation area for observation in the case of students before transportation home. Now, the symptoms that will lead to being in isolation, these are CDC guidelines. Fever, chills, cough, shortness of breath or breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, runny fever, nausea, vomiting, diarrhea. I will tell you, I have about 8 of those things right now I'm planning today. So can you imagine within our schools and talking to our nursing professionals throughout this plan, that is a lot of those symptoms there are a good day in a nursing office. Aside from bloody noses, bumps and bruises, how many headaches they deal with, how many stomach aches they deal with, how much nausea they deal with, vomiting. But under these CDC guidelines, and as supported by the Department of Health today in a conversation with our superintendents, if a student or staff member reports those conditions, they have to be isolated. And those in point of contact with them have to be isolated and quarantined as well. We're working with to get standing orders from our district physician. They still wouldn't override the Department of Health, but these are the concerns that we have. So walk with me through the first few days of school when we're back. How many students are going to come in and say, I have a headache? How many students are going to come in and say, my stomach hurts? But under today's conditions with COVID-19 and CDC guidelines, we have to treat that as if it's a sign or symptom of COVID-19. And then do the contact tracing, where we'll have contact tracing people that have volunteered within our staff. Many of our administrators, including myself, will be taking the coursework to do that. Our nurses are doing it. But it's most reliable, and our resource is the county health officials. And to this point, they're kind of taxed on this, and there's not really a lot of people to do it. So we're doing it on our own, learning about this so we can best protect our students, our staff, and our community. This is why masks are important. All students and staff will be required to wear masks when on a school bus or when in a school facility. There is always availability for flexibility and modifications when we're talking about a student or staff member with a pre-existing health condition. But in that, I'm not just saying that we're going to do nothing. There has to be something that protects the staff member, has to protect the student. It goes both ways, those in the class, from the respiratory droplets that we know are the cause and spread of the virus. The district will be providing 2 washable cloth masks per student and staff. We will also be having disposable masks on case in the schools, because we want to ensure that if students forgets there, staff member forget there, we have them there for them as well. One of my concerns in this with the masks, and why I think it's important to provide them with is, a lot of times in health concerns, the best possible health becomes an equity issue. And so it's many times the lower income students that are the victims of that inequity. I do not want to have students that have to come in with a subsufficient mask, gathering up a sweatshirt around their neck. We want to make sure that everyone has equal opportunity for good health and to stay in good health. Thank you. Facilities and cleaning. All districts' facilities will be cleaned with an EPA registered provided disinfectant that kills germs. Old Bridge Township Public School uses, I always have to move for this because it's in my way, Diversity Disinfectant, Virex 256, and Alpha HP. These daily surface disinfections will take place in the following areas: door handles, toilet fixtures, handles, light switches, elevator buttons at the high school, all desks and chairs, cafeteria tables when in use. At the elementary table, often they're folded up because they will not be in use, because we will not be using the cafeteria to serve lunch. We'll be using the grab and go model as we talked about. Exercise equipment, mats, phones, keyboards. Disinfecting wipes will be used for all electronics, including cell phones and computers. One of the questions asked, how often will the bathrooms be cleaned? Our goal is to have them cleaned every 30 minutes. Classroom bathrooms will be provided with elements that which they can be cleaned and sprayed and left sitting for 10 minutes. The key in a lot of the disinfectants that we use now, I hear of districts out there using different things. Clorox is not one of them that you're allowed to use in schools, but some listed as an item. But we are restricted from using Clorox products in many cases. So we will be providing EPA registered and recommended disinfectants for our schools, and to make sure that any of these surfaces that we're talking about are clean. And it requires not just a wipe. I know that's what we usually do at home. We'll be, wiping something down and using it right afterwards. Usually there's at least a 3 to 10 minute waiting period for that disinfectant to take place to kill the COVID virus. Thank you. We talked to, and we're very fortunate, we have a new director of facilities. His past life and his expert training is in the area of HVAC and air quality. And these are some of the measures will be in place. Since we've closed in March and our buildings have been sat dormant, all HVAC filters have been replaced. Since that time, we're assessing all equipment to determine our capability of increasing efficiency rate on those filters. So if we can bring more fresh air through those filters to maximize their ability to grab particles and viruses and unknown microscopic bacteria, if we could do that without compromising the filter. We're also assessing our equipment to determine the capability of increasing fresh air makeup. Obviously a big concern for Old Bridge schools. If you're a student of Old Bridge schools or a parent, not all of our windows, not of all of our classrooms have windows. The CDC recommends opening windows when possible, but schools are also required to take in 50% fresh air from the outside, even in any room. So even our rooms that don't have windows, they're always recirculating fresh air from the outside. So we're going to be assessing that equipment to increase, so we can allow on certain days to increase our fresh air to as highest extent possible without impacting the heat or the cold temperatures within that classroom. Proactive maintenance, including but not limited to cleaning the coils where needed and greasing bearings and replacing belts, were done as well. We're working proactively with Aramark, that is our custodial firm, and ensuring that all univents in all classrooms are clean and free of obstructions that could interfere with the proper circulation of the classroom. This is something to prepare yourself for. It's something that, we haven't had to worry so much in the past about, but extreme temperature days that we may get in September may necessitate that it became a full remote day, based upon the fact that having students wearing masks, staff wearing masks on days with high humidity and high temperatures within a classroom, it's not only going to be not conducive to learning, it's also, that could also cause further health concerns. So that is something we have to be aware of and plan for accordingly and proactively. Transportation. All occupants of school buses are required to wear a mask or a face covering. Individuals' health concerns documented by a physician that preclude them from wearing a mask or face covering will be provided accommodations and flexibility. Students will avoid touching surfaces that are often touched by other bus passengers. And again, that's the hard part here. I talked about this with my team and other superintendents. We're watching what's going on in Major League Baseball. How's that relevant? Major League Baseball operates with billions of dollars at their disposal, and they're dealing with adults in a separate group without fans interacting, and they can't protect themselves from an outbreak. So it concerns me to the level at which schools can do it when Major League Baseball, $1 billion industry, without any worries about what disinfectants, what filtration systems they can bring in, have trouble doing it, and haven't done it in a week's time. Drivers will use gloves if required to touch surfaces contaminated by body fluids. There's another slide for transportation. Transportation will practice regular cleaning and disinfectant of frequently touched surfaces, including surfaces in which a driver cockpit is commonly touched by the operator and between transportation runs. Social distancing on school buses is limited. So limited close contact and maintaining at least 6 feet of distance when possible. Students will avoid sitting within 6 feet of the bus driver. So we talked about our contact tracing element. If we run through a scenario of a student reports to school, is screened, has a temperature, according to the CDC, that student has to go on self-quarantine, get tested. The other students must self-quarantine. The bus driver must self-quarantine. That bus comes out of service and gets the deep clean treatment. And that will impact the rest of the day in which the bus must operate and staffing must operate. So what are our next steps as we go through this? Because trust me, there are a lot of next steps. This was our guidance and guidelines to present to you a very preliminary view at what we're looking at as far as a plan. The plan will have to be completely documented and provided to the Board of Education for their review and to confirm it through board action on Thursday. Still tentative. It will then go to the Department of Education for their review. And once they approve it, it will then go out to the public. And it may, because again, this is the first time the state has done this. They may have to go to the public with the tentative understanding that the board may have to revote on it again in August, based upon any amendments or modifications that the state has. Because as I stated before, there is a checklist that they're using to make sure we've covered all our grounds, but they haven't completed the checklist yet. So it's difficult for us to say that we've hit on everything they need us to have. And again, this is not everything within the policy, but these are what most relatable to our parents, our staff, and our and our students. And so these are the things that we're going to have to address. What happens now with these dates? We start to get to what I like, a granular portion of it. So we have a framework, we have a schedule, maybe modified, but by August 3rd, we're going to have, I know they talked about the survey going out. I went out already tonight. So a survey of intent, it does not lock you into 100% remote, but it allows us to schedule forward and look at our cohorts, to look at our 33% cohort. If there's a significant number of families that opt for the 100%, it may cause us to adjust that cohort number or percentage and the number of cohorts we have. We have to then notify our parents of cohort assignments based upon that prediction of your intent. By August 7th, you will have to then commit to select a remote learning only option. Within the survey, it talks about that. A form is generated. It tells you about the cohort being in 100%. And once you select it, you can opt to come out of it at the end of the first marking period. You'll be given the form again, another simple form again, to let us know that, if this is where we're at still, if we're not 100% remote, everyone then, or we're still in school, where maybe we've gone up to a 66% capacity because God willing, our numbers have gone down and we've stayed steady with that. And it's been proven to be safer, that you can opt at that point for the first marking period at the end of the first marking period to re-enter into an in-person model for the second marking period. Elementary, high school, and middle school students continue to working on establishing norms, expectations for those classes. Obviously, there's concerns there. The high school is different than, and the middle school is different from elementary school. There's a lot of changing and reusing of desks and equipment. We have to have protocols in place that ensure that between student use of any equipment, it's clean, disinfectant, given the proper rest time that allows a virus to die off. By August 21st, transportation routes must be complete its runs. We will also at that point begin launching our professional development. By September 4th, devices will be ready for distribution. PPE will be ready for distribution. At that point, we'll see where we're at. We'll see if we are having you come in to pick the items up. We'll see if you're going to get them in school. We'll know, I think I'll definitely know by that time if we are coming through with this practice or if the government has shifted in any ways into which direction they're going. Just prior to this meeting, Philadelphia Public Schools listed that they are 100% remote until November. Some other districts, without the guidance to do so, have listed that they are doing that as well. Another important things, and probably the most important things now that we have this framework in place in getting granular, we have to address the individual needs of different groups of students. We have to get into how do we best serve our special needs population through this, and how can we maximize their in-person instruction and remote learning opportunities with the capacities that we have in schools. Will we have the ability to meet them and provide them the greater level of support? Our ELL population, or social emotional learning components, what the roles are for everyone from the specials that we have in our schools to our guidance counselors, CST members, everyone re-examining and rewriting what those roles and responsibilities will be. This is different, obviously, than we had in March when it was on the horizon, but then kind of thrust upon us. And as the state requirement was at the time, we had a plan for a 2-week pandemic in our plans. But now we know for the future, all futures, that, we need a plan for a pandemic to last a year or 2 years. So we are hoping for the best in all this. We are a strong community. We always come together. And I think if we operate from that premise, that we will be doing the best we can for our students. I know there were some questions, and we'll probably get to them, about And if anybody on my team has access to the questions, and maybe we'll take turns asking them. I had to turn off for me on my end, I had to turn off the COVID reentry questions email address because you guys couldn't even hear me because it was beeping constantly. So I'll have to go back to that. We'll take turns responding to questions as long as we can, and to get into any repetition ones. I know there's a question I saw about have we considered sending the high school all fully remote and then expanding our students in the elementary level to start using the high school so we can take advantage of social distancing. On paper, it sounds good. However, we come to a student supervisory issue that if we take students in a class of 24, divide them into two parts of 12, so they starting in a class of 24 at Shepherd School, and now I'm taking 12 of those students and I'm moving to the high school that's empty because all the students are learning remotely. I have to have someone to instruct that second group of 12 that just went to the high school. I can't have the high school teachers do it because they're providing remote instruction to their students. Some people have asked about why an early dismissal. The early dismissal is necessary because while your child is in school for that day, they're going to need to, that teacher is responsible for them and the students at home at the same time. So they'll provide math that when I'm talking about this, talking elementary. I think they talked about 90 minutes of math, 90 minutes of language arts, 70 minutes of math, coverage into social studies and science, some social studies and science. During the course of that day, the teacher will have the right to a prep and a lunch. So hopefully getting that prep during the course of the time while your child is there, where they'll be in a special or physical education or of that nature, while that teacher gets that prep and gets prepared for the students that he or she may be teaching in the afternoon, providing that remote instruction, but any in-person remote, I'm sorry, I shouldn't say in-person, or live remote instruction to address students' particular learning needs from the remote angle of them. Teachers are doing a phenomenal job throughout this, and the pandemic is certainly not their fault, but we can only divide them in so many directions. And at the end of the day, they have to go home to their families as well too. So that is why the only way we have to do it is through an early dismissal model, because they're basically serving the needs of many on the same schedule. And that is, of course, necessitated by the CDC guidelines that has us taking a 600 to a 700 foot room and dividing it into enough space to have 6 feet square distance around a student, which basically allows you to have 9 students and a teacher. If it's a classroom with an aide, then that obviously the number gets reduced. And in a 50% model, we were not able to meet that CDC guidelines for all of our classrooms and students. Anybody else want to jump on any questions that you've seen while you're there?
Mr. Cittadino, there's one question that I keep seeing over and over, and it just, it's why do we feel compelled to open?
Why do we feel compelled to open? I'm working through a directive. I'm working through a directive that I have to plan for an opening. We're not at open yet, but I have to plan for an opening as required by the governor. When we look at our community at the end of August, and if there's an uptick in cases, and I confirm with the Board of Health, I confirm with the county superintendent, and I can confirm with my conscience that I do not think it's safe, then I will make that decision. But as of right now, I have to plan for an opening of students in person. That is the directive we are given. At the end of the day, for me to think that, based upon what we've seen, I think community's done a great job. This community has far exceeded many in protecting itself and social distancing. And through all that, you know, we've had quite a number of cases, and some fatalities. And my greatest nightmare is that someone contracts it within our student body or our staff, and it negatively impacts their family, and it leads into a very grave condition, or even worse, a death. You know, at the end of the day, you know, no one is going to say, you know, who opened the schools. It's going to be me. It's going to be my decision. So you know, at the end of the day, I have to say that I was directed to do so. But if my conscience says that it's not safe, you know, I say, then let them come after me that I did it, and they told me I didn't do it, and they told me I had to. But you know, probably the hardest decision I will make is, if it's made up to me. I really don't think it's gonna be left up to me. I just, you know, looking at all the writing on the wall, I don't think it's gonna be left up to me. But if it's a decision that I have to make, you know, I'm gonna wish for snow days. That's for sure. There was a question about, I saw about our security staff. What are we doing with our security staff? We have a shared service agreement with the township. Our SROs do a phenomenal job. These people are great change agents within our schools. We are responsible for 75% of their salaries of the 3 SROs, 50% of the supervisor salary of the SROs. So that's money we're locked into a shared service agreement. I believe in working with my BA. You know, obviously we have SLEO 3s or special 3s that perform security at our elementary schools. And if they're not needed because school's not in place, that's obviously money that we'd be able to save, and put in other directions. But, you know, they always, you know, harm always happens when you drop your guard. And, you know, this outbreak, this pandemic has been the only thing that has slowed school violence incidences. And it's sad that that's the only thing that's had a negative effect on those elements of school violence across our country. But as I said in the beginning, and as I say here at the end, safety is always my number one concern, and I will not shy away from that. You guys see any of the questions? Because I will go over to, if you guys want to handle the chat, any of the chat questions, if you can, and I will go over to the email questions.
Okay, there were some questions on here, Mr. Dino. There was a device question about whether there would be a computer option for students to borrow a device similar to the Spring. We are happy to say that we are moving to a one-to-one option for the districts for the 2020-2021 school year. There will be devices for high school, middle school, and elementary students, and that will be ideally rolled out in September when the students come into school for that first day. The district is utilizing funds that we received from the CARES Act to purchase those one-to-one devices to ensure students have equal access to devices for the upcoming school year. There was a question on homeschooling and having access to resources. The homeschooling component, if a student is homeschooled, they would sign out of Old Bridge Township Public Schools and would be considered a homeschool student. At that point, they would not have access to the resources for the district as a whole. At least that has been past practice.
The only thing we have to provide, I just want to jump in there. The only thing we have to provide in that situation would we have to provide just the curriculum, because the curriculum is a public document. If parents are in that situation, obviously they're doing it because of the health concerns. They could reach out to me and see what other things I can provide them with. For insurance purposes, you're not eligible for extracurricular activities and so forth. But if you need text or something like that in these extreme situations, I would consider that.
Great. And there was a question about special education programs. We will continue to implement students' IEPs to the greatest extent possible based on the time that they're in school and then the schedules as of those remote days. And the question about moving in and out of classrooms, we are trying to limit the cohorts and integration of students on a day-to-day basis. Therefore, the special ed schedule might look a little differently than it has been in the past for students who are in, say, a resource pullout class. But the district does have a number of programs in elementary, middle, and high school that we would be working with to make sure that the students are receiving the special education options within their IEP in a safe and secure environment.
Jim, while you're there, you want to talk about 504s? How will 504s be handled? Will it be different from normal teaching, somehow modified, or somehow modified? During the
Sure.
remote instruction, how will the lessons be administered? I think you touched upon, will interactive videos and conferencing be done? So just the 504 piece, how will they be handled?
Sure. If your student currently has a 504 and or an IEP, as has been in effect since March, both of those documents are legally binding documents, and the district will, to the greatest extent possible, provide the services as outlined in those documents. What I would recommend for anyone, any parent who is requesting a 504 or some other modification based on a student diagnosis, that they contact their building principal. Provide them with documentation stating that they have a 504 concern and are requesting a 504 meeting. And then accommodations and modifications as outlined in 504 would be provided within the confines of the school day, as well as during those remote learning sessions to the greatest extent possible.
There's some additional questions regarding supply lists, and that information will come out once we have more details to the instructional plan. We are rethinking, especially at the elementary schools, sharing items like crayons and pencils and having students have their own items in a secure area so that they are not sharing between other students. We have some questions about the platforms that we're using. The question comes up, regarding Google or Zoom. We are streamlining the platforms that we're using, and that is part of the checklist for staff. However, we do use Microsoft Teams. It is a platform that is secure for our students and our staff, and our staff continually are trained on it. We do have what I'll say is professional development for parents as well that we will be launching to help get parents up to speed with the platforms that we will be using for this year. One of the questions asks specifically about K-2 and whether the platforms will be changing for September. There are some variations. We certainly will be in a better place. I feel we can confidently say that we will be in a better place than we were in March. We are planning. We have teachers, administrators, instructional staff that are all working on improving and increasing the consistency across the grade levels. There's also some questions about, again, the live interaction versus the in-person interaction. So the live interaction on remote days. I don't know, Dr. Tui, do you want to speak to that at all, or do you want me to continue?
Sure. So, our goal on the remote days is to provide a similar type schedule for the students as if they were in school. We are looking at last year, a lot of the feedback that we received from the parents was that the 10 to 2 window of time for the virtual days was not enough time in terms of the provision of or the needs of not only the students, but also the amount of time that the students were doing their activities. So we are looking at those remote days, and each grade level will be a little bit different in terms of how the teachers are required to interact with the students. We are looking to have, again, going back to that slide previously, small group remote instruction. We're going to be looking at how all of our staff is utilized during the course of the day, including the RTI teachers, guidance staff, child study team members, and paraprofessionals to ensure that everyone is being utilized to the greatest extent possible in this time. And potentially, based on, again, your grade level, there could be multiple remote instruction components, some of which are, again, recorded, some of which are live. And that's something we're going to be moving once those days are further clarified.
I'm trying to go through, there's a lot of questions that have like 15 questions that are best to be easily that I just respond to them afterwards.
Would you like to address, there's a question regarding why can't we put cameras in the classroom?
So there's a few reasons for that. One, having a camera in a classroom and having it live within the classroom, there's already pre-existing PERC law against that. That's why in 0 schools in the state of New Jersey, there is a surveillance camera in a classroom. They're in the hallways, they're in libraries, they're in common learning areas, but they are not in the classrooms themselves. So one, locally, any union would have to forgo that. Secondly, when it's used for that level, we have not seen where it is, if you're talking about an average size school, even an elementary school, like one of our larger ones, to have the ability for 36 live streaming sessions to be going on, that it would be feasible and on our band and on the bandwidth and to be used practically. We believe, and the Teachers Association here believes as well, that our teachers can do better than that by providing support documentation, support videos, and then using that information from that starting point to have live interactions with students via our platform. So like a lot of the questions that I asked, I'm seeing were questions that they came up prior to us going over in the video conference.
We do have a question. Is this plan for the fall semester only? Our plan is carrying us through the end of November for the first marking period.
And again, like we talked about, is it scalable, that it can grow? The most important thing is to provide the greatest level of safety. We don't want to bring the maximum amount of students that we can bring in and then have an outbreak. And because once that happens, then it's over. If we have a massive outbreak, it's better to come into it with a 33% capacity and then grow as we learn through it and see what the level of the virus is in our area. It's one thing that all of our numbers that we receive as community members doesn't take into consideration, because the first thing to close when the first case happened in the township was the schools. So none of the data that we have about the number has that in place. And it's unquestionably true that the largest gathering of people, whether children or adults, in our community at one time, Monday through Friday, is in the schools. There is no other gathering larger than us within this community. So it'll be about bringing the information in, providing a safe entry point, and then growing from there.
We have another question regarding whether parents will be able to choose the cohort that their children are placed in. I would I would look at this similarly to student class placements, that these have been strategically planned, and a lot of consideration for trying to keep siblings together across all 3 grade levels, so they're attending in the same cohort, that it would not be an option where there's choice on which cohort, in which cohort or which day of the week students are assigned.
There's a question about after-school sports. Right now, and we have phase 1 of the NJSIA high school only available for students to participate starting August 3rd. This is a social distancing conditioning exercise, much like you see in all these outdoor gyms that you drive past in our community. There is no entry inside to any buildings. Student athletes must stay 6 feet away. They must do mostly the conditioning work, calisthenics, running, and if it comes to the point where there's any ball or dribbling drills or passing drills, there actually is no passing up in phase 1. Only if it's built, using a soccer ball or something like that. Field hockey, you have to have your own stick. You have your own ball. It's not interchangeable. That's the only thing that I have approved thus far. Based upon the NJSA, it has approved thus far. If we're looking at numbers going to the future and it becomes obviously to me that it's unsafe, then we will tackle that before. The NJSIA moved back all fall sports until September 14th of a start date just for practice. So the NJSA is trying to get us to let us open the schools and see what problems surface and then go from there.
Specific to grading, there were some questions about grading and grading criteria. We are anticipating in September going back to our A through letter grade system across all grade levels, and looking at the elementary level to ensure that there's parents have a good idea of where their students are progressing. So the grading criteria will be revert back to what we have done in the past, most likely effective September.
Someone asked a question about Cheesequake School. Could we reopen that for social distancing purposes? One, that school has already been rented and leased, and we received payment for it towards the $5 million we'll get for that school over the next 10 years. And as you know, we are still in a situation where we're losing state aid, $3.5 million of state aid per year, even as we're fighting through this pandemic. And that money was used to offset staffing. So we had to reduce staffing to deal with that $3.5 million loss. So if we were to bring it back, we would obviously, again, talking about, if you take a class and break it to pieces, you need other teachers to hire to supervise those students. No, if you choose 100% remote learning, you do not have to remove your children from the district. They just opt to be in the 100% remote learning setting, but they're still Old Bridge students and could participate in any Old Bridge activities that are done remotely. If they are participating in the conditioning exercises that are taking place with CDC guidelines, then they can do that as well. Before and after care, we had a conversation with the township as far as before and after care. They're developing a plan. They're looking at other venues, but I'm not going to speak to how they're going to carry it out, but they are aware of that concern and are looking to at least assist the district and its community with a varied approach or a varying approach to before and after care. How do we enforce masks? We are going to, again, today's work is to talk about having a framework and a plan. How we will do components of student code of conduct will have to be reimagined or revised to address these situations. I know it's not going to be easy to get students to wear masks. I know it'll be difficult, but I know it's possible too in most situations.
We have some questions regarding the, if parents should choose the hybrid, can they change and go remote at any time? And it will, of course, it will impact busing and it will impact the classrooms. However, it would impact it in a way that we could manage. Whereas if you choose 100% remote, going back into the classroom would not work the same way. So I believe the answer to that question would be that it would be an option to go remote after starting the hybrid.
Right. So I had that question earlier. It was basically a question of, is it possible? Yes, we'd have to look at again, this all relies too on staffing. We anticipate some staffing concerns going forward too. Some, members of our staff have family or themselves with pre-existing health conditions that would preclude them from coming into the school environment. So we must accommodate that. We'll have to look at our numbers for those choosing 100%, and where we can accommodate, we will accommodate. But we can't do it back the other way. Once you choose the 100%, you would have to be committed to it until the end of the first marking period. As far as the transportation question that I got, that, if you plan to drive your child to school, we're also going to present you with that waiver, so that you waive the transportation for that period. That's important to us. We don't want to have expecting to pick up students and then not pick up students, and some day they're there and some days they're not, because that's how we become in a situation where we're vulnerable to not having a student that we're supposed to have with us, or dropping them off at a wrong stop. And again, can't say it enough. Safety is the biggest priority. Sometimes it's inconvenient, but safety is the biggest priority. So if parents choose to opt for not the transportation for that marking period, then we'll not have that transportation for that marking period.
We have several, and I'm seeing a trend of questions asking about what do we do if a child tests positive for COVID? And specifically, does the whole class quarantine, does the cohort quarantine, and what would be those procedures?
So this is going to be one of the situations that I think a lot of people who aren't in education haven't thought about, and that's why it makes it more difficult. That's why, and I use a lot of sports analogies. That's why the NBA, NHL might be doing best with a bubble type of thing, a bubble type of planning. So if we have a student exhibiting COVID symptoms, and we all went through that list, those are everyday symptoms in my house. If we have a student exhibiting COVID at times, we have to treat it as if it is a COVID case. The student will go out, quarantine, and get tested to return to school. The second portion of it is, who else was in that contact list? The teachers, the people on the students, those students in that classroom. It because COVID-19, you can be communicable and still not develop a symptom for 3 days. So over the course of those 3 days, who was that student in contact with? That's one of the good things about the 33% cohort. You're most likely not going to have been in with your cohort, so it doesn't eliminate the cohort. But in that over the course of 3 days, so in that situation, we get guidance from the Department of Health. We get our standing orders from our doctor. If those standing orders and that guidance says that classroom, that teacher has to self-quarantine, that also goes to the siblings of that student that may be in high school, and those people who that student has come in contact with. So when we talk about the complexities of doing this with a school, it is a web, the contact tracing piece. It is a far-reaching web across the community that makes this a very difficult process. And the fewer students that you have in contact with each other, the greater ability to provide safety in those situations and to provide a responsible reaction to a possible outbreak.
So we have questions about the first day of school, which the original school calendar was September 3rd. And one of the things that came up in our task force meetings was the need to have more time to provide training and updates to staff who come back on September 1st. So we are proposing to add to the usual day that we have off for in-service in November, which is election day, will be a remote learning day. And that in-service would take place on September 3rd, giving us 3 days at the beginning of the year for staff training and preparations in the classroom, and students would start on September 4th. I want to add to that. Oh.
Yeah, that is twofold on that one. One, our staff, you have to remember, they left abruptly on March 12th. Much of their classrooms are the same as when they left them. They need extra time to get in there and get those classrooms ready. They need extra time. They're not healthcare professionals. They need to learn how to better protect themselves and their students with positive professional development. But on the other hand, this the election day coming up, being a presidential election, I will not, it works out perfectly that we can make it a remote day because, one, we are besieged with complaints from the election board because of parking issues and so forth, even when we have our staff in doing professional development on that day. And because, of the climate of this country right now, I don't want any of my staff and I don't want any of my students in a school on election day. Again, erring on the side of caution. So we will do a remote day on that day, which is usually our staff in-service day. And the second to third, the first, the second, and third of September will be in-service days.
And I want to add that we are preparing training for staff in addition to the health concerns that we're facing, the social emotional well-being of the students and the staff themselves, to address and understand some things that we might see as students re-enter the building. And even students who choose or parents who choose the 100% remote option, working with our staff to recognize signs from students who are struggling, and even parents who are struggling in managing the new school life. We are working on that to assist all parties.
Someone asked about the screening of students, and I just want to reinforce that. So the screening of students is prior to exiting the bus, before they enter the school. That is our plan that we are presenting. I talked about why it can't happen at the bus stop and why we believe the 6 feet of the 6 foot distance in there, having the least amount of students as possible on a school bus, wearing masks is essential. We cannot screen students for their health at a bus stop, because then we are responsible for them all the way through an examination by our school nurse. We can't have nurses on 65 buses doing wellness checks for us and follow-ups. So we're going to get our students to school, screened off the bus, screened on the bus before departing, and then once, if we've got a reading, that whole cluster will go to the isolation area. The student with the fever will be in the isolation tent getting a reading. Possibly it's a negative reading. And once they have reinforced that it's not a positive or a fever reading, then the group would then be allowed to enter into the school. But we want to screen that out prior to them entering into the school for sure.
There are some questions regarding orientations. Our orientations are being prepared for remote presentations. So, and another question similar was, will parents have an opportunity to see what schools look like? We are preparing some, I'll say, looks inside of our buildings as part of an opening presentation. Even with open houses, at this point, we are looking at preparing them remotely, having pre-recorded presentations and filming some of the areas within the schools so that parents can see what kind of changes and what updates have and what the classrooms look like, and students as well.
Yeah, so there's a lot of questions too about, middle school, high school, transition of classes. One, that's the entryways, doorways, hallways are going to be marked as far as when we can in the larger schools for one way. We'll stagger exits from classrooms so that students aren't passing each other in the hallway. Have one entrance in, one exit out in many ways, so there's not that cross contamination of people walking by. Obviously, the big question still is, and we're examining all opportunities to deal with it, is at the secondary level, students changing classrooms and having one student using a desk that another student would be doing. Again, we'll have less students in there, so we can mark off possibly ABC day desks, ABC cluster desks. That if you are in a cohort A, you use a cohort a desk. There's many different things, but it would still require some level of cleaning, and it's not as easy as you could do if you can't say that the teachers don't switch, but the students don't switch, but the teachers do. It's not possible at the high school, and even less, and still less possible at the middle school. So we are working on that. I answered the question about the transportation, that once you do the waiver, you can change that waiver after the first marking period. Connectivity questions. So we also just received eligibility, again, a turnaround. They told us on Monday, we have to have it in by next Monday, a grant for the digital divide grant. I received a very unurgent survey from the state about 3 weeks ago, talking about what we need to provide, digital connections, hotspots, Wi-Fi's, whatever devices for our students to go one-to-one and have connectivity at every home. I based my responses on the fact that I thought they were rechecking our CARES application for CARES funding for the same purpose. and it turns out that districts who did not respond to that survey got $0. We were able to get a substantial sum of money, but it has to be directly related to, like I talked about, connectivity issues. So we are looking at ways that every student device would then have its own ability to receive Wi-Fi from Altice. So no matter where that student is working from, they would have Altice Wi-Fi throughout the community. Dr. Tui, are you available for a question? And what is the plan for Glen School, Southwood School preschools? Are parents expected to pay full price for their younger students going partial day, 1 day a week? Or will there be an opportunity to go more days? And concerned about a 4-year-old sitting in front of a PC performing remote learning.
So right now, the preschool schedule is going to be divided in potentially 2 cohorts, where there's an AM and a PM session just based on the numbers of those students. Tuition rates are being determined. If we're going on a half-day schedule, it would be a lower rate for the full-day tuition students. We wouldn't be charging full rate for a half-day program. Dr. Lombardi is working on a schedule not only to include transportation, but to provide all the preschool students with a positive academic environment. That plan is still in the works, and we will release that once it's finalized.
We have a question. Oh,
Go ahead.
we have a question here regarding staffing and teachers who visit multiple schools, and that's significant at the elementary level with our related arts staff. We are planning for our elementary students to receive related arts, but it will be on a different schedule than they're used to. So if we have a music teacher that shares 2 schools, they will be assigned to one school for in-person, and they will visit the other students on the remote days for the first marking period. And then we will shift and they'll go to the other school. So we're containing staff. All students will have some form of the in-person related arts on the days that they are present in school, and remote on the days that they are working remotely. And we will rotate the related arts teachers. We do have some shared staff between the middle and high school, some of our world language, and we are working on managing that to contain, again, the staff and who they come in contact with regularly.
I received a question about the remote learning and how we expect to be different. How do we expect parents who work both full-time to now take the additional full-time job of teaching the children? And are there any expected tax cuts for education? Again, I'm not ignoring this question. I think, as you can tell by those little beeps that have gone on, I have received probably close to 100 emails on this site prior, just the course of the day. So if I didn't see you emailed it 2 or 3 times, it just, every time I email and one comes in, one gets knocked to the bottom. So the remote education, we have a full team that's working to make that better, more interactive, more to have more student self-reliance, more guided practices, where students will have expected hours to work through in the course of the day. I understand it completely, the concerns about working. And I understand the big emphasis on reopening the schools in the face of a pandemic is based upon the economy. It's based upon getting people to work. And it ignores the health concern of it, as we discussed. But I have to work from a place of providing a healthy, safe environment for not only the students, but the staff. And I can't do that and ignore the CDC guidelines. So a CDC guideline tells me that I have to have students in a class with 6 feet of distance in a 500 to a 650 square foot class. The math is simple. I can only do that with 8 to 9 students in there. And I have to then account for any teacher, push-in, paraprofessional that might also be in the classroom. We do not have the ability to have any more than that in there in that capacity. So if I do ignore the CDC guidelines and say, just go full day with full students in there, then I'm ignoring the health dynamic of these students that I'm sworn to protect and the staff that I'm sworn to protect. It's not easy, trust me, to put out together a formula that is going to meet the needs of everyone. At this point, the goal is to provide students with some level of in-person instruction, greater remote instruction, and to keep them safe. It is not an easy formula to put together, and I have an answer for how the childcare portion takes place. I will work with any group out there that wants to help perform childcare, but again, it can't even take place in my buildings because at that point, according to the guidelines that I have, I now have, at the end of the day, when those students leave and a new cohort comes in, I have to disinfect and clean the building. These aren't people passing through Walmart. These are students that are stopping, staying, working in a building, working in a desk. And, if you're around students and children, there is a lot of expression of respiratory droplets that takes place during the course of the day, to say it politely. And we need to make sure that our environment is safe. I spoke to someone in that running a store that locally, and they stated their biggest concern, and to hope everybody understands that they can't enter the store because they want to keep their staff safe. They want to make sure that everyone knows that the staff is risking their health. Are not my staff risking their health? Are these teachers not risking their health? They're going to come to work, do their work, address the needs of the students that are in front of them, address the needs, and by the end of the day, address the needs of the students that aren't in front of them. And like everyone else, find ways and hopefully find ways to take care of their families that are at home. It is a sacrifice on everyone and everyone's part. Dr. Tu, do you want to address the role of paras and sub-paras during remote learning?
Sure. As has been the course in the spring, paraprofessionals are on the guidance of the classroom teachers. While we are looking for alternate ways to include paraprofessionals more within the day-to-day workings of the classroom, the paraprofessionals would still be under the direction of the classroom teacher. There are additional options in Microsoft Teams that would allow for paras to interact depending on the level of student need and support in a more active basis. And we were looking to implement that for September. That was one of the main things that has been brought to the forefront from parent information from the spring. Just to go into some of the general plans, Mr. Dino, Dr. Hoker, on special education. The special education programs for each individual student, is individualized, and we intend to maintain that as we go into the school year. It is also important to keep in mind that the calendar and the days and the cohort levels are a baseline from which to work. They are not there for the special education population. We are trying to address, again, to the greatest extent possible, all the goals that are outlined within a student's IEP. Is it a challenge in a hybrid or remote model? Absolutely. But at the same time, we are looking at each particular student. We're looking at what their respective needs are, and we will make decisions on individual student programs along with the IEP team to the best of our ability and provide students with what they need. There were questions about related services. As of right now, related services and the delivery related services potentially could be a hybrid model where some of the options are online and some of them are in person. Obviously, if a student is in person on either Monday, Wednesday, or Friday, the goal will be to have the related service providers provide as much individualized and group activities as possible. Additionally, the time in school would be contingent on potentially a student's program. Some students need, based on their IEP goals, additional assistance during the course of the day. And that additional assistance, obviously, if it can be done in person, we would do that. And whatever we can do remotely on those full remote days, we would do as well. All of the special education programs right now from preschool through high school are fluid and are in flux. And we will continue to finalize our plan as the district continues to finalize its plan, ideally on Thursday with the adoption of the 33% model. If a parent has a question about their student's IEP going into the fall, the recommendation is that they would email their case manager and ask some specific questions about the student's program. And if they don't, the case manager would address those as they can. And we would move into September with all IEPs being implemented again to the greatest extent possible for the upcoming school year.
A question about how long is the plan laid out for? We've learned from the past that this plan is meant to adapt and either grow or retract. But it's a plan for the year. I'm not saying we're going to be doing this for the entire year. I'm hoping that we get some relief from this horrible disease. We get some type of maybe a vaccine in the future that brings us back to some semblance of normal. But right now we're concentrating on the first marking period. That's what we're talking about. Let's get us to there. And if we are in school, I mean, we by no stretch of the imagination, my team has to develop this plan based upon the governor's orders to have in-service in-person education, and we're doing that again. But we're also developing a plan in case we don't. So that is where we're at. It's the plan that could be stretched out and amended to the complete year. But we're looking at marking period 1, the end of marking period 1, as our baseline to see where we are at that point. Before and after care, again, that the township is working on a way, and they've been cooperative with us, trying to find a way to meet the needs of the students that are in school or out of school that day. Isolation, it's going to trade a whole different thing. When anybody has to go into self-quarantine, obviously we have to be notified if it's a self-quarantine based upon home, because that's going to be another issue in this. Parents work in New York City. They may be the source of the quarantine at home. We need to be notified. We need to be notified in how that impacts us in school, and what cross-contamination did that student have with other students or staff within the school. When self-quarantining, it doesn't count. It's an excused absence. When a staff has to use self-quarantining, we have to continue to supply them with their salaries. We would just need documentation from their healthcare provider that they're under quarantine, and they're under quarantine and because they have COVID, or B, they're under quarantine undiagnosed and they can continue to work remotely, or C, that they are sick, and in addition to being sick, that they did a COVID test. Because let's say you go to the doctor as a staff member, and you are tested and you come up with their 5-minute test on strep. You have strep throat, but the doctor says that I'm going to test you for COVID as well. So your days with strep throat, which could be 3 days, your first onto the antibiotic, would be sick days. If you're still out because they're waiting for the COVID result for 4 or 5 days after that, which we hope is never the case, those days aren't sick days. Those are under the federal COVID emergency plan. So the district would have to provide you the opportunity to pay you, or where you will work remotely because you're no longer sick because you don't have strep. It's very complicated. It's going to be interesting to track all that. But that's where we're at. But if you are a staff member and you are directed to quarantine, for the most part, you're covered. If you have questions with that, I've worked with Mr. O'Neill on that very cooperatively, and we kind of went through some talking points, and I'm sure he could help you with that. The form for opting out of transportation, that will be coming. It will be forthcoming. We have some time before we get to that one. We put out the survey today of everyone who is going to tentatively look at putting their students in the 100% remote model. With that information, you'll receive information about the August 7th, when you have to select that model and enroll your child in the 100% remote model. After that, you will then be asked to, we can then look at the transportation waiver. If a child has COVID under quarantine and under quarantine, can they remote learn? Again, that's going to come down to the doctor's note. It depends on the severity of the situation. For the most part, it seems that students have mild situations, but if a student is also having, respiratory issues, the severe aches, headaches, high fever, it may be better that there's some point of home instruction for that. I'm getting confused with all the terms that we use, but home instruction may be a possibility for that, where there's accommodations built into the deadlines in which work has to be done, because if you're sick, you really shouldn't be doing the work, because we'd rather have you rest and get better. Questions about holidays and so forth, we're working it out so there is amicable and equity, I should say. Equity is better on the calendar based upon taking in Monday holidays and so forth. Looking at substitute staff, I was just talking to another district that just changed over to substitute staff. Most are, because of the federal guidelines that have come out and make tracking substitutes and almost impossible. But I foresee there could be great challenges for getting substitutes to fill into a position. If we have a staff member go out for a classroom that has COVID or has COVID itself, I don't know how many substitutes are going to sign up for that job. We're looking to address those needs as best as possible. I'm confused by this question. Are you saying that you want students to coming to school and not remote learn when they're positive? No, I'm saying when they're positive, It may not be remote learning. It's a different designation. It may be home instruction. That's the instruction that we provide for our sick students who can't do the work. When you're on remote instruction, you're not going to get accommodations as to when work gets done. You have to sign in and be responsible for your work and get your work done as if you were in school. When a home instruction, if you have a student who is ill, and it depends on the severity of COVID-19, the illness, home instruction may serve that student better because they get greater time to complete the work. Again, this email address will be up for the foreseeable future. I'll be answering questions for most of the day tomorrow. Just because they're here doesn't mean I haven't read it out loud, does not mean it won't be asked. There's a lot of questions that are multi-tiered, 6 questions, going upon, or they're very personal questions about their own child and their child's particular educational needs. So I'll go through a few more, and then I will tell you that we are going to do another one of these prior to school starting. We'll see where we're at. And I would say in somewhere in the latter part of August, get together with another one of these, and advise you as to any changes and modifications we've had to make, any new information that we do have, and obviously any guidelines that have come up, or deadlines that have come up that you need to be prepared for as we get ready for schools to open, if and when that does happen. I'm not going to leave you hanging and not get back to you. And so these emails, all these emails on the COVID reentry questions email address will be answered in due time. And we will do this again and set up another one. So let me just go through a few more questions, and then we are going to call it a night. So the question is, does my high schooler older than 16, or as a parent, have the option to opt out of a whole school year and return the next year? It's like taking a high school gap year. I know that at that age, Dr. Tui, this is more of your area of expertise because you were the administrator of guidance. Can you address that?
Sure. So if a parent has the option to to sign their student out of school between up to the age of 16, if they sign their students out of school and they are not indicating home instruction, there are some parameters that the district does have to follow, because in theory, then the student would be truant. If your student is of high school age and you are requesting that your student is signed out for homeschool, and you don't provide that homeschool, then at that juncture, you would be responsible for the grades when you sign that student back in. If you do so and you sign that student back in and that student has no grades, then they would have to repeat that school year, whether the student is a sophomore or a junior. So that's, I guess, one way to take a gap year. I don't necessarily recommend that. At the minimum, if your student is using the remote learning, even if they're struggling using the remote learning, they would be actively participating in academics and have access to online resources. If that, for that specific question, if you want to reach out to me via email and I can set up a phone call with you specific to that gap year question, I'd be happy to do so. And then any of the other questions specific to, again, special ed or some of those more specific individualized questions, I'll review the list with Mr. Ciudino and Dr. Hoker as to the emails come in. And I think we will be collecting those questions and creating a frequently asked question sheet, collating that information that the parents, and students and staff have asked tonight, and presenting that to the public to ensure that everybody is well versed in what the questions that were answered tonight and what currently have yet to be answered.
Dr. Tui, the case managers are not in office till August in some situations. If they have a question about an IEP or changing, should they best direct any questions to you, copy your secretary on it?
That's fine. You could actually just copy me on the email if you'd like to. We do have 2 case managers who work the entire summer. They're currently working with the extended school year program. I can refer the questions to them if it's a specific student related question. Additionally, if there's a question, there are some case managers who are working in the summer. They're doing testing and they're doing some general case management, and we are still running meetings for students who have requested evaluations towards the end of the school year. So we do have some staff in the summer. We will try and address any questions that come up as quickly as we possibly can to ensure that the parents are comfortable with the programs that are being offered in September.
All right, I'm just going to email that question to you so you can reach back to that person with the best contact information.
Sounds good.
A question about the school nurse, will they have stats seasonal flu tests to differentiate from COVID? Obviously, if test is positive, the individual would be sent home, but further quarantining may not be necessary. It's a great question. I mean, I know that the last time we've taken that kind of measure, I think, was H1N1. I think we did some vaccines in school, those school nurses. Again, it comes down to our district doctor and putting it in the standing orders for what our nurses can give and administer on a test. And if that's something we can look into with the support of the Board of Health, obviously we would look into it. The more answers we have at that point of, that's going to be the hard part in all this. And I hope everyone can understand that. I'll put my camera back on because that's going to be the hard part in all this. I hope everyone understand that. Ensuring the safety of everyone, but dealing with the symptoms and our requirements under those symptoms to put quarantines in place for what used to be prior to March 12th, 2020, were run-of-the-mill district-wide nursing concerns. The number of students that we get in our school with that list of symptoms is going to be a bear to manage. One of the things that doctors in the past have been able to do is give a standing order that certain students who suffer from headaches, that they can be administered Tylenol or Motrin or whatever the doctor is providing them to have. Our new standing orders do not allow that because we just can't treat a headache as a headache anymore. We have to treat a headache as a symptom of COVID-19. And again, it's not a district policy, it's not a board policy. That is a CDC guideline. It's going to create a great challenge, and it's a challenge that there's going to be a lot of flux and change within that school schedule, and who can be there, who can't be there, based upon those issues that were simple prior to March 12th, but are not simple any longer. So obviously, in relationship to that, parents asking if the student is not sick, don't have COVID, but they have a headache and nausea, one, you should keep them home. And I know it's difficult for parents, but if that's there, then you keep them home and not quarantining. Can they work remotely from home that day? Yes. And make up the work. Yes. Contact your teacher, email, my child is not coming in out of an abundance of caution. I would like to be able to work remotely, and we can accommodate that. It's better to err on the side of safety than to have your child come in. There were, again, options. Why this schedule selected? As I told everyone in the beginning of the task force, was made up of a very diverse background coming from different areas and inclusive of parents. This was the overwhelming majority that was selected. And I think even more cautious than I was, because the need to, and I agree with it, the need to make it scalable. We have a lot of unknowns, and I hope if I've one thing I've reinforced with you tonight is there are a lot of unknowns going into the 1920-21 school year. And I would rather approach those unknowns as cautiously as possible and then grow as we get more information and more data. Like I said before, the numbers of people who have contracted the virus and the numbers of people who have tested positive in Old Bridge is without the schools operating. And we are the largest component of this town of mixed groupings of people. And that's the same statewide. It's actually most of the point nationwide. Even some of the, southern western states that have gone back in August, they've pushed their start date back. So there's really no data in this country under our conditions, under our CDC regulations, as to what to expect when these schools open and how that'll impact the local numbers of COVID-19 cases. Again, sneezing, coughing, it is difficult, and I don't know if we'll have at that point, doctor's note on staff. I'll have, again, a lot's going to come from our doctors or standing orders that we get from the doctors and the health department. But if a student who has diagnosed allergies, and comes in and says, I just think it's allergies, I don't think within the guidelines and the standing orders that we're going to have that we're going to able to just assume it's allergies. I don't like to get too personal, but my son, he, with his allergies, he gets headaches. So when he had headaches, we assumed that it was just allergies. And he's now, he just came out of his second bout of mononucleosis, and that was directly related to the headaches that we were just assuming was allergies. So, I hate to assume that something is a headache related to an allergy, because, I know people get them, I get them with allergy season comes around. But again, you have to err on the side of caution, have proper testing done so we can rule out the worst case scenario and then get back to, okay, it's just an allergy, come back to school. So I think, maybe I get of this a few times, and this will be our last question. And then I'll not last question live, but I'll keep answering questions over the course of time that are on the email address. Jim, can you just touch off base on how the groupings are done, and also reinforcing that siblings are in the same grouping? We don't want you to have siblings in different groupings.
So when the plan was originally created, the easiest and simplest way to divide the groups into the three cohorts was alphabetically. So we took all the students in our student information system, divided them up into thirds. That information was distributed to the building level principals. We started with the high school and then moved from the high school to the middle school, as the high school has obviously the most amount of students. They were divided into thirds alphabetically. Middle school followed suit. And then those three cohorts, the two middle schools and the high school, was pushed down to the elementary levels. All of our administrative team, and I have to give kudos to all of the principals, they really worked their tails off to make sure that these cohorts are as clean as possible when it comes to siblings. And across each respective grade level, again, elementary, middle, and high school, all of the administrators worked to make sure that the cohorts included all siblings within their respective group. Now, is it possible that one or two students were not in that cohort? Absolutely. Once the cohort information is pushed out, if you have a concern about a student not being in a cohort, or there are multiple siblings potentially with, you have two different families, or a blended family in the house, please make sure that you reach out once the cohort information is released. And I believe that will be completed sometime early next week, so parents can begin to plan for where their cohort is. It gives them about a month to establish what day they would be in school.
All right. Like I said before, I'm going to keep on answering these questions. Maybe not tonight. It's past 9:15. But all your questions that have been gleaned or inspired by our tonight's presentation will be answered. And we will then have information about our survey that has gone out to you tonight about your intent. Doesn't lock you in. I want to reiterate that. Does not lock you in to the 100%, but we just need to do it so we can look at our cohort numbers and best arrange our schedule. And then you'll be provided with information, the August 7th date, as which you have to lock into the 100% remote cohort. And with the understanding that's for 1 month. One marking period. So that information will be coming out. We'll be giving you more information in the coming days and weeks about documents, forms that must get filled out. And again, we'll bring this all back together. I thank everyone for being here tonight, for answering great questions. Every question I received was great and very respectful. I appreciate it. It's a great town, great community. We all work hard together. And gosh, I appreciate you guys for it. So thank you to my team, this board, for the support. And, it's going to be a tough year. Just I hope everyone can appreciate the sacrifices and the risk that our staff, our teachers, bus drivers, custodians, maintenance people will be doing. Food service is always there for our students. So thank you very much, and we'll talk soon.